Welcome back to my channel. Today we are going to take you through the antihypertensive medication, and if you're watching this, know that you missed out that detailed video on describing what hypertension is and what we should do in general to manage our hypertension. So the first drug that we'll be looking at in the antihypertensive classes is the ACE inhibitors. My name again is Motes Caroline, and I want to thank you for watching at Life with Nurse Caro. If you haven't subscribed already, it's not too late, and this would be the right time to do it. So, just to remind you, there were different classifications of antihypertensives, and which we categorized as A, B, C, D, where A had two major medications, and the first one was the angiotensin converting enzyme inhibitors, or the ACE inhibitors. The second one was the angiotensin receptor blockers, or what we call the ARBs. The third one was the beta blockers. The fourth one was the calcium channel blockers. The fifth one, which is D, are the diuretics. So let's look at our angiotensin converting enzyme inhibitors. So these medications target the RAS system of the body, hence inhibiting the effects of the would have been angiotensin 2. The angiotensin converting enzyme is produced by the lungs, and it's responsible for converting angiotensin 1 to angiotensin 2. Angiotensin 2 is a vasoconstrictor and is responsible for increasing blood pressure in your body. So, the ACE inhibitors target this enzyme. Hence, the angiotensin 1 cannot be converted to angiotensin 2. In response, the body is unable to reabsorb more water and sodium by the kidneys, and there will be no vasoconstriction, hence leading to reduced peripheral resistance, reduced afterload, reduced blood pressures, and there will be a reduced workload to the heart. So for us to understand the action of the ACE inhibitors, we need to understand the renin-angiotensin system very clearly and how it works. One, when there is a drop in the blood pressure or due to the drop in the fluid volume, the kidneys will sense and release what we call the renin, and this renin will have effect on the angiotensinogen that's produced by the liver to make it change from angiotensinogen to form angiotensin 1. So angiotensin 1, for it to be converted to angiotensin 2, the lungs will have to produce angiotensin converting enzyme to change angiotensin 1 to angiotensin 2. And then from the angiotensin 2, which is a vasoconstrictor, this is when we'll start seeing effects. The angiotensin 2 will act on the vessels directly, causing vasoconstriction, hence narrowing, causing high blood pressure. The angiotensin 2 also will act on the adrenal glands, stimulating the release of aldosterone. So aldosterone causes the reabsorption of sodium and water in the kidneys, hence increasing your blood pressure. So where is our ACE inhibitors? So the ACE inhibitors, all the angiotensin converting enzyme inhibitors, will prevent the formation of angiotensin 2 from angiotensin 1. That's where the effect is. So these ACEs that are produced by the lungs will have a drug given at that point in time to prevent their actions, to prevent the enzyme action, which is responsible for conversion of angiotensin 1 to angiotensin 2. So what are the examples of the ACE inhibitors? If you're a patient and you have a package or you have a prescription and you don't know where your drugs fall, which classification they fall in, the memory lane will be ICE. I'll call it ICE, but it's ACE in apple. So ACE in apple, I'll pick the angiotensin converting enzymes. In apple, I just need to pick the pril. So ACE in pril. This is just a memory lane. Thinking about ICE in apple. So ACE inhibitors usually end in pril. So you look at your prescription and you see something called benazepril, captopril, enalapril, lisinopril, whatever pril is there, and you're hypertensive, know that this is an angiotensin converting enzyme inhibitors. They usually end in pril, ACE in pril. So what are the major indications for these drugs? They are used to prevent, treat, and improve symptoms in conditions such as hypertension, the major topic we are looking at today, but also in coronary artery disease, in heart failure, in diabetes, in certain chronic kidney diseases, heart attacks, and also in migraines. So you will see them prescribed for these different conditions. What are the major side effects of the ACE inhibitors or the ICE in April or the prils? I'll summarize the major ones that you need to take caution when taking this, and I'll use the real name ICE or ACE, the ACE. A will stand for angioedema. The C will stand for cough. The E will stand for extreme tiredness, dizziness, and potassium. So that will mean that the potassium will be highly increased. So, other things that we can look at. The dry cough. This cough is going to be dry and very irritating. Actually, it's one of the indications for change of the drug. So if this person is not coping so well with this dry cough, it's extremely irritating and it's affecting their way of life. This drug may be stopped and they're started on another classification. This drug causes hyperkalemia because you're trying to get rid of the water and the sodium, but potassium and sodium go in the opposite way. So as you're excreting the sodium, you're retaining more potassium, hence causing hyperkalemia. There will be excessive tiredness and dizziness. We are looking at lowering the blood pressure, and that some of the effects of lowered blood pressure is hypotension, which will make you feel tired because the vessels or the organs are not receiving enough blood due to the reduced pressures. You get headaches. You have loss of taste, and then the hypertension that we've discussed. So rarely, these drugs can cause short-term worsening of kidney functions, but it can exist. These drugs can cause angioedema, and if this happens around your breathing tract or in your face, the lips, around the mouth, and then the throat or larynx, you need to worry because this is a medical emergency, because that person's airway is almost closing off. So there are extreme measures that you need to put in place and intervene in case this person is experiencing these. However, this angioedema, since it affects the loose connective tissue, it could also affect the extremities, where someone sees edema in their extremities because they are on this medication. So there are some few contraindications when taking this medication. For patients taking NSAIDs, you need to know that you need to stop one of the medication. You can't be taking both NSAIDs and ACE inhibitors. And the NSAIDs are basically painkillers. For example, ibuprofen is one of the NSAIDs, and you can't take an ACE inhibitors and ibuprofen because they have contradicting effect on your blood pressure. Pregnant mothers, taking an ACE inhibitor will increase the risk of birth defects. So if you're pregnant and you prescribe this medication, you need to inquire from your doctor or the prescriber if this is really safe, especially if you're in a period where you're pregnant and you're at risk of birth defects. Again, I want to thank you for watching. Next, we'll be looking at ARBs or angiotensin receptor blockers. Don't forget to watch, share, and like. Most importantly, please subscribe and Life with Nurse Carol for more content. Thanks for watching. Take care. Bye-bye.